California Governor Gavin Newsom has issued new orders banning indoor events to help curb a spike in coronavirus cases in that state. That ban includes public masses in 30 counties. That said, outdoor masses and other liturgical services such as adoration and prayer services are allowed and are being encouraged. As of today, the total number of coronavirus cases in the U.S. has surpassed 3.4 million cases with more than 136,000 deaths. Here now to help us take a look at where things stand in the fight against COVID-19 is Dr. Pham, visiting policy analyst at the Heritage Foundation. Dr. Pham, welcome to the show. Great to have you.
Thanks for having me.
So we're hearing so much recently about this rise in coronavirus cases across the country. What do you think is causing the spike?
The spike is the result, I think, of Americans growing complacent. Prior to June, we had been doing very well. We didn't just flatten the curve. We really sliced the top off of it. If you looked at the curves of daily cases starting sometime mid-April, then the number of cases really plateaued before they started to taper off. And we had been doing so well, I think, that Americans got complacent and started going out. And the proper reopening strategy was really a slow return to normalcy, but the month of June, admittedly, was neither slow nor normal. So I think these factors put together is causing this dramatic surge in cases.
Let's talk about California governor's decision to halt indoor activities, which includes mass. What do you think of Governor Newsom's decision, and do you think it's the right strategy?
I think it's going a bit too far. I understand the need to react to changing realities on the ground, and I think it's appropriate to react. However, he's going very far, and he hasn't released any information about where these new cases can be traced to. And then so indoor activities, especially mass, I managed to go to church once in California before he closed things down again, and the parish had done a lot to ensure the safety of its congregants, and quite frankly, shutting down all the indoor activities is punishing, especially mass, but also barbershops and salons and those kind of businesses, is punishing them, even though they've reorganized their lives around COVID-19, is punishing them for the actions of others. And I don't think that's necessary. I think the measures that they had put in place would have been sufficient to maintain mitigation efforts.
Well, right now we're in the middle of July, but the school season is right around the corner, and states around the country are also wrestling with whether or not to reopen schools this fall. As a medical doctor, what would you suggest? And if states do opt for in-person learning, what measures do you think should be in place for the safety of the students as well as the teachers?
The AAP, the Pediatric Association Academy, they have a really great set of guidelines about what states should do or what school districts should do. But the main principle is that the important thing are the students. And so we should have these schools. But that having been said, most of the risk is not going to be coming from the students. Most of the risk is going to be in the adults. So that's staff, faculty, and parents. And those are a lot of potential contacts that we should target our interventions towards. So it's not unreasonable to ask students to wear masks or face shields to protect the teachers, and any kind of interactions, for instance, parent-teacher conferences, that should be done electronically. There should be social distancing in the staff lounges and those kind of areas. But we should have in-person classrooms and make sure our interventions are targeting those at risk, that is the adults, and not be punishing the students or the children.
Well, Dr. Pham, thank you so much for your insight. Dr. Pham, visiting policy analyst at the Heritage Foundation. Thanks again.
Thanks so much.